500 years from now, looking back, this period of time will have a name.
Welcome to the second annual RAISE Health Conference. The delivery of healthcare is being accelerated and indeed transformed because of AI.
We need to not only push the boundaries of what's technologically possible, but also ensure that these advancements serve humanity in the most beneficial and equitable ways possible.
Often what happens is the people who have the most need for that innovation are last to receive it.
All the amazing work that's being done to build these AI tools won't work for these communities until we can work on that human side of the trust equation.
We often have a lot more problems than we have time to solve.
We have unbelievable amounts of data, and that is what's fueling AI now.
Physicians are craving education. 26% didn't know if they were using an AI tool in their clinical workspace.
The students are probably figuring out faster than we are. The whole nature of our education and training process has to adapt along with that.
AI has an ability to absolutely change the game. So both in how we look at surveillance data, how we design new vaccines, diagnostics, therapeutics.
The key is really going to be about building systems where researchers far upstream are thinking about the downstream consequences, building ethics into their approach.
It's about being honest and establishing a level of trust about what your data will actually be used for.
We're all in this together, and we're all have a common goal of wanting to improve outcomes.
We have this unprecedented opportunity to meet people in the moment.
The future of AI and health is patient-led.
It's a bold vision, but it's a vision that I think we at Stanford are uniquely capable of carrying out.